Good afternoon. I'm delighted to be here, and I will be talking about an initiative called Howard County Unsweetened, which I was involved with and had the opportunity to evaluate, working very closely with the Horizon Foundation. So Howard County Unsweetened is a campaign that is really designed to improve the nutrition environment in Howard County, specifically around sugary drinks. We published a paper with our initial findings a couple of months ago, so I'll be providing some of the background on that paper, some other findings to date, and give you an overview of the whole campaign as well as some future directions. And I just want to acknowledge Horizon Foundation is located in Howard County. Their mission is to improve the health of people who live and work in Howard County. So this was very much a community campaign that started in that community. So the demographics of Howard County are sort of interesting and I think important to note. There are about 317,000 residents in Howard County, but it's unusual in that the income is quite high. The median income in 2015 was $110,000, and at that time was the fourth highest county in terms of median income in the country. Also very highly educated. As you can see, 28% of the residents have a professional degree. At the same time, it's not a homogeneous county in terms of race and ethnicity. So you can see from this graph about 54% of the residents are white, 19% Black, non-Hispanic, 18% Asian, 7% Hispanic, and 4% identify as other. I'll also mention that the free and reduced rates of the schools in Howard County, also there's quite a range from 4% in some schools up to 40% in others. So there's some sort of diversity in terms of income within the county, even though the overall median is quite high. So despite the education and the income average, they're not protected from the risk of childhood obesity. So these numbers, I think, were part of what really motivated the Horizon Foundation to look specifically at childhood obesity and what could be done. So in Maryland, overall, the rate of overweight and obesity in children is 27%, and Howard County is 25%. So it's really quite close. So here is the social ecological model, which I'm sure we've all seen in theory. And what's really neat about this is the social ecological model in practice. And so this slide was actually created by Glenn Schneider at the Horizon Foundation. And it, has lots of things, and you'll have access to these slides afterwards. But the idea was really to take this model and come up with ideas at every level, from the individual, interpersonal, organizational, community, all the way up to the policy level. And this has been a multi-year strategy. There are a lot of components. Things, have sort of been tried. New things have come in. And it's been complicated, but very, very exciting. So one of the things that was really neat was that we were brought in on the sort of the ground level back in 2011, 2012 to design the evaluation so that as this campaign went along, we were able to track it and see changes over time. So one question, as I said, they're focusing on sugary drinks. So one question is, how are they defining sugary drinks? So early, the campaign ads mentioned soda and also literally used the term sugary drinks. However, in response to some evaluation data we had been doing in terms of what children were actually consuming, we noted that it was really fruit drinks and sports drinks that were far more common. And so more recently, in response to that information, the more recent ads specify fruit drinks and sports drinks explicitly. They do talk about 100% juice, and the messages about limiting portion size. They're consistent with the American Academy of Pediatrics policy, although that wasn't really a big target. It was something, though, that in their work with pediatricians, they certainly talked about and was mentioned in some of the online materials that they have. Flavored milk, we assessed it. So in our student survey where we're tracking consumption, we do know consumption of flavored milk, but we didn't track flavored milk in terms of retail sales data, and it wasn't addressed explicitly in their messaging. So let me start with one of the individual and sort of family level interventions, which is called the Better Beverage Finder, and the website's at the bottom. But basically what this was a website that they designed because they felt like if they were going to tell people not to drink sugary drinks, they needed to give them some ideas of other things that they could drink. And I know certainly from this meeting the answer should have just been water, but people really wanted to feel like they had other choices, and there really are new products coming on the market that are much, much lower in sugar water, and many of them are flavored waters flavored with natural things. And so they put this together, and I encourage you to check it out. What you can do is you can search for beverages. There are different criteria. It will then give you lists and sort of a code where you can determine what types of sweeteners are used. And then, interestingly, they give you a little map where they can show you where you can actually purchase those products in Howard County. So this was really designed to sort of give people some useful, practical information. And as you can see, it was really targeted to the person buying the groceries. And they use the language a lot of talking about this is, for moms when you're shopping for your family. So the media campaign that was during the time of the paper that we published, the evaluation from 2013 to 2015, were messages primarily targeted at mothers. There were 30-second spots on local cable television. They had digital and social media ad buys, direct mail to county households, and all together, when I was writing the paper, I was like, I need to know sort of what was the overall effect, and the calculation that they determined was 17 million impressions during that period of time in the county. So here are some examples of some of the ads that people saw. On the left, you can see want to make mornings easier, try them unsweetened. So you can see this is really targeted at parents, and they explicitly talk about sugary drinks down there. Another here was focused on sports drinks. This message, don't sell her short with sugar, sending people to the Better Beverage Finder to find other things to drink. Another message was about getting your kids to sleep at night and serving only water and milk, not sugary drinks afternoon. And then another message was just keeping it out of the house altogether. So really targeting what you're doing in the grocery store and not bringing it into the house where you're going to get into a struggle with your child. So home, unsweet home, and skipping the sugary drinks, keep them out of the house. So those are just some examples, and there are others that you can see on their website. This one we totally took from New York. So this is 20-ounce soda a day. You need to walk 21 miles. So this was sort of locally relevant from the Columbia Mall to Fells Point. And then this other message also pretty focused on regular soda, talking about the number of empty calories and translating that into weight gain. So in addition to that individual, sort of intervention with the marketing campaign, there was also quite a bit at the community level. So there was a project with child care centers. They formed a program, it was called Healthy Howard, and child care centers could participate. And we've talked about the knapsack program a lot today. It's sort of the same concept. It was bringing child care centers along, having them set goals, we helped by evaluating their policies and practices, help them set goals, help them change their policies. And the focus was really on improving the beverages, screen times, and supporting breastfeeding. And so that was going on the whole time. During this time, the Howard County Public School System also updated their school wellness policy, which was, as those of you who have been involved in that, an extensive process, putting together the committee, giving them lots of resources. At the Red Center, we evaluated their old policy, we evaluated their revised policy, provided feedback on places where they could strengthen their policy. And this, was a really comprehensive process. A lot of residents were involved, over 500 in that process, and the policy, of course, reaches 55,000 students. In addition, at the community level, the Horizon Foundation oversaw something called the Better Choices Coalition. So these were community organizations, faith groups, and businesses that came together and agreed to improve the vending and food that they had at meetings and serve as an opportunity to educate their members, clients, and visitors about sugary drink consumption. And you can go on the website and see the list of people here. In addition, the American Academy of Pediatrics Maryland chapter was involved. They formed an obesity learning collaborative that had 13 practices and 40 providers, and they worked together talking about sugary drinks, talking about how to talk to patients about sugary drinks. Materials were put together that physicians could have in their offices, things they could hand out to patients. This is an example of a pamphlet that you could have in your office and hand out to patients, really talking about sugary drinks. So all of this also occurred in the context of a state coalition. So Howard County is just one county within the state of Maryland, but at the same time, the Horizon Foundation and other important partners you see listed here were involved in Sugar-Free Kids Maryland, which was working together to pass state level, to do state level advocacy. And that is large, over 250 members. And I think interesting and important to note, there was a lot of earned media with the different campaigns that they had. So people were being exposed to media stories about the topic of the different sugary drink relevant policies that they were working on, and then included front page articles in the Baltimore Sun. So that was kind of in addition to the campaign ads that had been purchased. So some of the policy changes that occurred during this time, one is in 2014, there was the Maryland Healthy Eating and Physical Activity and Child Care Act. So that reaches all of the children in Howard County, but that's a statewide, that was a statewide piece of legislation, and that specifically restricts sugary drinks and child care, also addresses screen time and supporting breastfeeding. Then this is interesting. So this is at the county level. There was a healthy food and beverage on county property ordinance, and the purpose of this was to make healthy food and beverages more widely available in government-owned vending machines. So that included not just government buildings, but parks, the library, any place that was owned by the government in the county. This had sort of a tumultuous kind of up and down process. There was originally a county executive order pretty early on in this period of time. It was then repealed when a new person was elected. Then it was passed again by the council. Then it was vetoed, and then it was overridden. So it was like a lot of back and forth. But I think sort of like what happened in New York City with the portion cap, I sometimes think that the conversation around these more controversial projects is a form of education in and of itself, because it kept the topic front of mind. People knew, that the government was doing this, and whether they were in favor or against it, they were thinking about it. And I think that that is probably important in terms of eventually behavior change. So our evaluation plan, we have a variety of things we're doing, but specifically what I'll present here is a study we did on retail sales in grocery stores over the course of the campaign. We also did an annual survey of sixth graders throughout the county on a variety of behaviors, but a lot of questions on their beverage consumption. As I mentioned before, we've been coding their child care and school policies, and we've also done some surveys of health professionals. So for the retail sales data, we worked with a company called IRI to match up 15 supermarkets in Howard County at baseline with 17 supermarkets in a neighboring state. And this is what this company does generally to help people, to help sort of the industry figure out, if I do this particular promotion, is it really going to help me sell more of my products? So we sort of went to the same process that the industry uses to track campaigns that they're working on. So we specifically looked at soda, diet soda, sports drinks, fruit drinks, and 100% juice. We looked at the baseline sales patterns of Howard County stores. So in blue are the Howard County stores, and then in red are the control stores. So this was really something that IRI helped us identify these stores, and they determined that this group of stores was the best match at baseline for Howard County. So these data are from 2011, 2012. So this is before the campaign started. So then the analysis we did was a difference in difference analysis, which basically compares the change in Howard County with the change in the control stores over this 3-year period of time. We were looking at the outcome variable of volume sales per product per week, and we controlled for a number of things, including the average product price, the competitor's product price, the product size, weekly local temperature, and manufacturer. So that was how statistically we tried to control it as carefully as we could. And so this graph shows, I think, sort of the biggest effect that we saw, which is in the sales of sugar-sweetened soda. So the sort of dashed dot line at the top, those are the volume sales in the control stores. As you can see, stayed relatively stable over the course of the study. And then the dashed line right underneath it is what we would have expected in Howard County had nothing happened. And then the solid line is what we actually saw. So as you can see, before the campaign began, things looked pretty much the same. Once the campaign began, we started to see a fairly steep decrease that then continued over the course of time. So in the end, soda sales fell about 20% in volume and remained stable in the comparison stores. There were other significant findings. Fruit-flavored beverages with added sugars also fell about 15%. That was a significant difference. Interestingly, sales of 100% fruit juice also fell about 15%, significantly more in Howard County than the control stores. Sports drinks, though, they are very difficult. They did not differ between the groups. The sales were kind of up and down. You can see them in the paper. But we really did not see significant changes in Howard County in sports drinks compared to our control groups. And diet soda was also interesting. It wasn't different between the groups, but it did go down in both groups. So that was kind of, I thought, telling that if one of the worries was that people might switch, worries in terms of small children, if people might switch from regular soda to diet soda and concerns about artificial sweeteners in children or even adults, that doesn't seem to be happening. We weren't seeing that sort of substitution, at least in the data, the way we were looking at it in this study. So moving on to the sixth graders. So we've been surveying all the sixth graders, approximately 3,700 each year. These are the baseline numbers. And so these data are the percent of students who report drinking this product at least once a day. So if you kind of look all together, how many students in 2012 said that they were drinking a sugary drink at least once a day, it was 58%, but the asterisk is that if you take out flavored milk, it's only 49%. So there definitely is a group of students that the only sugary drink they're consuming is flavored milk. But you can see here the numbers for fruit drinks, flavored milk, sports drinks, flavored water, tea, regular soda, and energy drinks. And again, even though these are sixth graders, I think it's really not the regular soda as much as the fruit drinks that seem to be the most popular, followed by the sports drinks. Water, though, is 97%. So I also think that's interesting. It's not that the kids aren't drinking water. So it's not as though we need to convince them that water is a good thing to drink. They're already drinking water. They're drinking it every day. So I think that we're trying to think about messaging and how to get them to consume more water, sort of building on what they're already doing anyway, is something to think about. 60% were also drinking plain milk, and as was indicated before, diet beverages are really not very common in this age group, only 7%. So here are the data for the sixth graders from 2012. So 2012 is red, 2014 is dark blue, and 2016 is light blue. And you can see there was a decrease over time in most of the categories. So fruit drinks, flavored milk, sports drinks, flavored water and tea, regular soda, and energy drinks. But then this also sort of shows you the relative percentages of daily consumers across each of those. Water was high, stayed high. Plain milk was higher. That's not a significant change in plain milk. There was a significant drop in 100% juice, and then diet is pretty flat. So one thing that I was really interested in looking at was whether there were differences by race and ethnicity. So, were all these changes just happening in some groups of kids and other groups of kids were not changing at all? So this shows the breakdown so the white kids all the way at the end, there was a significant drop. For the black children, it didn't change, it didn't improve that first between 2012 and 2014, but then by 2016 was going down some. But that's concerning that it's higher and not going down in the same way as the other groups. Hispanic children was highest to begin with, but has been dropping, and then Asian was lowest and dropping a little bit, not a significant change. So this is sort of an interesting picture in light of looking at disparities in equity and how these changes are occurring across different groups of children. Specifically asking about sugary drinks at home. So we asked the kids, if you drank it every day, so those numbers were lower. We also said, do you have this in your house? And so it is going down some for fruit drinks and regular soda, but there's still a lot in kids' houses. I mean, it's still between 50 and 60%. Sports drinks, really no improvement there. Energy drinks, much lower, but also stable rates. So, conclusions and future directions. I think that this local community-based media campaign and policy change effort is really helpful because it was coming from the community. It wasn't sort of external, and there was a lot of back and forth and listening that the Horizon Foundation did to community members as they decided how to move forward. Evaluation plan set before campaign started is awesome. I can't tell you the number of times at the Red Center we get calls like, oh, we did this great thing, can you come evaluate it? And it's already done. So this was really nice to get called ahead of time. We also were able to provide data that they could use to guide their messages. And I think kind of it's sort of the good news and bad news. The good news is things are definitely getting better. Both the retail and the self-report data suggest that, but sugary drinks are still quite prevalent. And again, racial ethnic disparities still exist. However, changes are occurring across all groups. So it's kind of a mixed message there. And finally, the current messages, they're trying to address the racial and ethnic disparities a little bit more in a targeted way. So they have some messages that are in Spanish. They also have some new campaign sort of videos that focus on real people. Like they have one that's a coach, talking about telling his, students who are playing soccer to drink water, that they don't need sports drinks. And I was just going to show you this one ad. This one was specifically for small children that I could show you. This one's brand new. Is there no sound? It was working before. Well, it's really cute. So the little kids in preschool, and there are people trying to get them to drink these little fruit drinks, and they're sort of popping up behind the blocks, telling them to go ahead and try a sip. So the site is up here. You can go. They have a YouTube channel, as you can see, for Howard County Unsweetened, and all of their ads are there. They also have ones of kids, trying to make their own sports drinks and having all the ingredients and seeing what actually goes into sports drinks. So thank you very much.